Hi, I'm Dr. Ian Wilson. I'm the Emergency Director here at Wangaratta. At Wangaratta we support a whole lot of little small hospitals, their patients, their nurses and their doctors. You'll commonly get phone calls from GPs about advice about what I'm going to do about this person with chest pain, what I'm going to do about this ECG, oh my God, do I need to thrombolyse this patient who looks like they're having a STEMI? Using this system as a way of supporting both them and yourself so you can see what's going on. We'll get a phone call.
I've got John Citizen here and I've just transferred an ECG to the server.
And then with the digital ECG, we're actually able to have a look at the patient's ECG, give some advice to the doctor or the nurse treating the patient. And it's a way better way we've got of looking after these patients than the old way of faxing or taking a photo of these ECGs and then being able to look at the ECG, manage the patient. We're able to record our notes on the digital ECG. If you need be, you can get the medical registrar to have a look at the ECG and give you some advice. The other thing about the digital ECG platform is it keeps a record of all their old ECGs, and so you're able to compare the two ECGs on screen. It gives you far better resolution images, so it's a way better way of dealing with patients with chest pain and their ECGs than what we used to do. What I'm going to do is go through the digital ECG and how you actually find those images. So you find the icon, double click it, open it up, it's the one with the ECG on it. Once you've logged in, using your normal computer login, not the Orion, but the computer system login, you open it up, you go to the actual screen, you're looking for unconfirmed ECGs, looking for the institution, you're then going to find the facility, which is going to be from Bright. I'll say that this ECG is from Bright, and then we're going to search for those ECGs. The ECGs will come up, you'll identify the particular one you want from this particular patient, and you're going to have a look at that ECG. The ECG comes up, have a look at the ECG, you can actually go back, find all their past ECGs, comparing the waveforms, getting calipers, putting different waveforms on the screen. You can do your notes on the screen, so you can write what you think the ECG shows and what you advise, and you don't have to get any other paperwork involved. Just be aware, when you're working here, we have a service agreement with these little hospitals, and we say we're going to maintain and support them. So doing this process is part of our job here. As a hospital, we indemnify you. We're saying, you know, you're looking after these patients appropriately. I want to reassure you that actually just looking at the ECGs, writing your notes in that little box and confirming it is all you need to do for your documentation for these particular patients. When you look at the digital ECG system, there are a couple of things that you're looking for. You're thinking, can we manage this patient up there locally? If I have a look at the ECG, talk to the doctor, and then keep the patient there, there's nothing that is a red flag that they need to be brought down. The other possibility is that you've got a patient and you think, gee, there's something worrying about this. There's something worrying about the ECG, there's something worrying about the patient. You may decide you're going to do a telehealth consult and say, no, this patient looks too sick. A whole range of things that would say, I need to transfer this patient down to Wangaratta. The one that we're all aware of is, could this be a STEMI? So this patient, you look at the ECG, you hear the clinical story of crushing central chest pain, you're saying they're going to need thrombolysis, in which case you're going to advise the doctor or the nurse to actually call Ambulance Victoria. They'll then come and retrieve the patient, and if they haven't given thrombolysis there, they'll actually thrombolyse the patient themselves, and they'll organise transfer to a tertiary centre.